the majority of your patients are really suffering. This endocrine disrupting stuff is starting in utero, like before you're born. We start seeing it develop throughout that patient's lifetime. By the time they come to see you in your clinic, they've been dealing with this for 30 or 40 years. It's a damn shame. But again, to give hope, we have hormone replacement therapy. It is a silver bullet for a lot of different problems and issues that men and women suffer from. And I thought of it like a science experiment. I said, okay, what if I combine the best of functional medicine, which is really just the ability to not be totally married to evidence-based, right? We venerate it in one sense, but in another sense, I'm open-minded enough to know and accept that, hey, it's just science evolves, right? And there are many other signals out there and many other ways I can think through problems critically that maybe science hasn't quite been able to catch up to yet. But also include this functional medicine, or the conventional medicine understanding that, there is some value, some serious value in some pharmacological measurements. And I mean, there's a no-brainer when that comes to antibiotics. If you're super, super sick with a bacterial infection, right? We're not going to just oregano oil that away all the time. In fact, oregano oil might be the worst thing you could do for a very specific type of bacterial infection that just requires a very specific type of antibiotic. So it kills just that bacteria, not all of the bacteria. So natural does not always equal better. Far from it. Please put that in if you're taking mental notes or if you're somehow writing real notes, please understand natural does not always mean better. And what do we mean by natural? But what we do know is that conventional medicine, technically speaking, gave rise to hormones. And particularly, I'm talking about bioidentical hormones. Now, they're synthetic in the sense that they're made in labs, right? That we take a sweet potato, a wild yam, technically speaking, and we take a cholesterol molecule from that wild yam and we twist it around in a laboratory and we create testosterone and progesterone and different things like that. So natural in one sense, synthetic in another. But what we're really getting to is that the geometry, the structure and function of that hormone is bioidentical to the hormones that we produce. And I think that's just so fascinating. I think that stuff's just mind-blowing. I'm coming up with all these ideas like, God, I would talk about that for an hour too, maybe someday. But I want to get back to the point. I found that I think one of the most functional things that we can do as providers, whether you're truly like deep in functional medicine trained, Institute of Functional Medicine or one of those, huge conglomerate types of internal certification things, bodies, or whether you're just sitting on the conventional medicine side and you're just kind of sick of what you're doing. You're frustrated. You're like, God, I feel like I can't help anybody. I think that hormone replacement therapy in many ways is an answer, it's dang near a silver bullet for a lot of different problems and issues that men and women suffer from. And we can see that in the literature from this huge, even epidemiological and observational data, all the way down to the randomized control trials. We know that hormones are being affected by this, again, toxic environment that we live in. And we don't have to, feel afraid that feels hokey or goofy or anything, because it's super real. I mean, even the freaking current presidential administration, whether you love them or hate them, RFK's in there talking about this stuff to the American public and to the world. And so there's something literally in the water that's hurting us and in our foods. And we've seen it in some of the clinical trials and studies, artificial dyes and the phthalates and parabens and all these plastics, right? So at the very least, can we take that known fact, and can we just assume at this point that most of us are all being affected by this? And if I look for objective data points on those specific things, hormones, do I find problems there? And I'm telling you, when you get into the game of hormone replacement therapy, it's going to feel kind of scary, because when you're looking at hormone levels, all of a sudden you're going to realize ain't nobody quote unquote normal. Okay. Everybody is kind of in this weird suboptimal range. In fact, the younger my patients are, the worse their hormones are. And I know a lot of you have seen that. If you haven't started checking hormones levels yet, it's kind of terrifying in a weird way. It'll kind of wreck your brain for a second. But that's how bad it is, guys. But to give hope, what I want to tell you is we have really good appropriate therapies for this. And I'm not talking for, there is a percentage of people who have absolutely fine hormone levels. There is. I see them occasionally. There are people who really, seriously, just a little bit of diet, exercise, lifestyle, they can absolutely get out of this hole. But I want you to understand that's a minority of people right now. Hopefully we see that change in the future, but right now that is a minority. The majority of your patients are really suffering, and they're suffering from an early age, guys. I mean, this endocrine disrupting stuff is starting in utero, like before you're born, it is starting. And we start seeing it develop throughout that patient's lifetime. By the time they come to see you in your clinic, right, they've been dealing with this for 30 or 40 years. And it's a shame. It's a damn shame. But again, to give hope, we have hormone replacement therapy, bioidentical hormone replacement therapy. And you would just be floored if you're not familiar with the data and the research behind it. This is why I created HRT University. Like, let me show you. Let me present this to you. Top to bottom, left to right. Let me make it so clear as to why we're doing this for patients. I've never, ever, ever seen any other course come even close to describing the why behind hormone replacement therapy. Not even close. I mean, I understand the whys behind, well, it supports, preventing osteoporosis and prevents cardiovascular disease, which, by the way, is awesome. I talk about that too. But the deeper why are we seeing so many people suffer all of a sudden from this? Am I supposed to give it to young patients? I thought this was only for, like late middle age and older patients. Can I do that? Is that legal? Is that safe? Am I going to hurt this person? Because none of us want to hurt any of our patients. That's why I created HRT University. I want you to feel confident and comfortable and assured. And further than that, I want you to feel empowered. I want you to feel like I got this. And I've got this for my patients. I've got this for my community. Because I'm telling you, it's funny. I just had a conversation with a good friend of mine. His name's Andrew. Amazing nurse practitioner. And he does TRT for a lot of his male patients. And he had this cohort of police officers that he was treating. And the head of that department where he lives, unbeknownst to Andrew, was seeing all these crazy changes literally in his police department. Andrew's treating like 10, 20 guys there. And he knew Andrew, like they knew they have a relationship outside of, like a professional relationship. He said, Andrew, you don't have to tell me who you're treating, but like, I think you're seeing a lot of my guys for TRT. And I just want you to know the guys that you're seeing for TRT, the cops, the police officers, they are so much better at their jobs, within their relationships, with how they handle situations, that literally our department is changing because of it. And our community is radically evolving because of it. It's so good that I want you to come in and talk to the whole department about how important this is. I don't know enough about it, but whatever you're doing with these guys, the TRT stuff, man, does it work. Like, wow, what a crazy cool thing to hear. And that is what I see. I see it every single day. It's the best feeling in the world. I see men and women self-actualizing. They climb that ladder, that pyramid, that's Maslow's hierarchy of needs, right? They are able to get to the pinnacle of who they are as human beings when their hormones are in check, when they're balanced, when they're optimal. they don't have to worry about survival anymore. They can start thriving and they can be creative. They feel comfortable and they feel whole again. And now they can help other people get to that mountaintop too. And you and I, we're just one little part of that. But man, oh man, is it an important part. Thank you so much for checking out this clip and tuning in. I hope you enjoyed it. If you really liked it, I definitely recommend that you click here to watch the whole entire video where I go into much more detail. Thank you again for joining, and I'll see you there.